Viewers, you're welcome to another episode of Monitor Your Health, the program where we educate the public on contemporary medical issues in the country, well, in the continent. Today, we have another interesting topic. We're going to talk about lumps and bumps. And my name remains Dr. Femi Ogunremi. I will be your host, and I have a guest, an expert in this area to join me in discussing this very important topic. I have Dr. Oluseyi Idowu, an orthopedic surgeon who has track record in various areas, especially sarcoma and things like that. So, Dr. Oluseyi Idowu, you're welcome to the program.
It's nice to have you. Thank you so much for having me. Thanks a lot.
Thank you. Please, can you introduce yourself to our viewers?
Oh, okay. My name is Oluseyi Idowu. I'm a surgeon by training. I work at the National Gobi Lagos at the oncology division. So basically, what is treatment of bone and soft tissue and of course that includes soft tissue benign, malignant, soft tissue cancers generally.
Okay, thank you so much. The network is quite crap actually, but I hope we'll be able to just manage it as it is for now. I'm hopeful it will improve as we carry on. So today we know that there are lots of concerns when we find something new on our body. We want our body, our skin to be smooth. We want everywhere to remain the way it is. And then when we see something quite abnormal, something that isn't there before, we panic. And this is where the lumps and bumps become very, very, very important. So we're going to just discuss around this. Dr. Idowu, so what are lumps and bumps?
Okay, so thank you. When we talk about lumps and bumps, we're basically talking about swellings on various aspects of the body. It can be the limbs, otherwise called the extremities, like the upper limb or the lower limb. It's also neck. The neck region commonly has lumps and bumps. It could be on the or the front of the body, which is the basically the trunk. I don't know if you can hear me well. Which is
we're hearing it breaking a little bit, but I think we're managing to pick it. Yeah.
Okay. So lumps and bumps refers to swellings. When it's very important aware that not all swellings are benign. Benign means swellings that will not cause you trouble. They will not grow out of proportion, or they are not sinister. By sinister, talking about what we describe as cancer. I don't know if it's better now, this network.
Yeah, it's a bit better now.
Okay, so the swellings generally occur on surfaces, and they may be deep to what you're seeing on the skin. Some of them may be what we call the deep fascia, which is a plane of tissue lying underneath the muscles and the skin. And when you ever see a lump, or what we other call a not smooth, doctor, I can feel something like a bump. That is commonly what a very say. It's important to check it out as soon as possible because it may be larger than what you think underneath the skin. So that underlines the of lumps and bumps on various parts of the body.
Okay, thank you. So why do we talk about lumps and bumps? Is there a difference between the lumps and the bumps, or are they the same? I mean, why lumps and bumps? Why not lumps and why not bumps on their own?
Okay, Dr. Ogunremi, so you're already seeing it just depends on what part of the world you come from. So some people, as in, look, there's something like a lump on my skin. Normally, the people who are more endowed people. If you have somebody who is more endowed on the larger side, they may not even know that there's a lump, or they can't describe lump because they think it's actually part of their body fats. But what can raise alarm is when you feel that there's a bump. Oh, when I'm having my bath or when someone touched me, they can feel a bump, something that is not right on my on the surface of my body. That is an important thing to check out, to ask your doctor or a primary care provider to have a look at it for you, because some of them actually even occur on obscure parts of the body. If I have a lump on my back, for instance, most of the time is your family members or your friends that will tell you that, oh, look, there's something on your back. And that's the only time you can see the alarm. So I think it's just a matter of what part of the world you come from. Lumps and bumps mean the same. But the important thing is that they have been used to describe swellings on the surface of the body, which will raise alarm to something that is going on deeper to the surface of the body. And I don't know if at this point you want me to go into the various types of lumps and bumps that we can have.
Yeah, we might as well just go into that. So, it's fine. So okay. Let us know the types that are available.
Okay, broadly, for the purpose of for all of us to understand what lumps and bumps are, the importance of the entity lumps and bumps is whether they are benign, which describes a swelling that is not cancerous. It may be there for several years, it may not transform, and it may not bother the individual. There are usually things like lipomas. There are usually things like fibromas. You can have other kind of cysts underneath the body, the skin surface. The more sinister ones are the cancerous one, or broadly terms in when you're talking about the surfaces of the body, the sarcomas. Other cancers can occur on the surface of the body, but because most of the body is composed of, most of the surface of the body, the skin, is composed of connective tissues. They are connective tissues. And when you have cancers of the connective tissues, the scientists call them the sarcomas. And there are over 50 different subtypes of these sarcomas that have been recognized by the World Health Organization. So I don't think that's important for most people. But what is more important is to know the one that is sinister, which is the second type that I'm describing. And the way to know them is that that's the one that grows at a higher rate. You see that it's growing from one size within a few weeks or a few months, it become larger. They are the ones that are usually more than 2 centimeters. Okay, so and when we talk about lumps and bumps, one of the things that have been coined by people in providing care for people with musculoskeletal tumor is the golf ball size. I know that a lot of people don't play golf in our part of the world, but if you remember, that golf ball is just about the size of a table tennis ball, like a ping pong ball. So what I tend to say to people is, if you find any lump on any part of your body that is the size of that tennis ball or more, which will give you roughly about 3 to 4 centimeters, that is a reason to worry. It is better for you to get that checked out by somebody qualified, and then you are reassured that there's nothing more to it than that lump. The other thing that if you have an opportunity to see a physician that actually can delineate that better, examine it properly, is any lump or any swelling that is deep to the deep fascia. I know a lot of people won't know what the deep fascia is, so that's why we leave it to the expert care providers. Even your primary care providers can tell you that I cannot move this with the skin, or I can move this with the skin. So lesions that are deep to the deep fascia are deemed to be more likely to be the cancerous type rather than the benign one, which I said are the simple type that don't grow out of proportion.
Right. Wow. Okay. So I'm going to come back to this maybe later, but let me ask this question: How common do patients present with these symptoms?
Okay. So if you look at the benign lumps and bumps, the way they are very common. You find out that a lot of people might have noticed at a point in their life that they have a lump or a bump on their body. The question is to go back to that guide that I've just discussed earlier, whether it's more than that 3 to 4 cm that we said, whether it's the size of a golf ball or a tennis ball, or whether it has grown suddenly, because those are the worrisome signs that it's starting to grow bigger. There are people who have been born with lumps on their body, which we call sometimes birthmarks, and they stay there for ages. They don't change in the size. They remain the same size. They don't bother the individual. So I think that those ones are quite common. And I'm talking about the benign ones. It's quite common. But the malignant ones, which is the cancerous type, the other type, are not so common. So the ratio of the benign one, which is the simple type, to the malignant one, which is the cancerous type, is about 300 to 1. But then when you have a single one of the cancerous type, it is devastating, because if they are not caught early, they are difficult to treat. And I'm sure as the program progresses, we'll talk about the available treatment options. So if they are caught at an earlier stage, and I'm talking about even the cancerous ones, they usually can be eradicated and we can achieve a cure. A cure means the individual doesn't need to bother, that 10 years survival can be good at a stage of that early stage, at the early stage, if it's picked up at the early stage. But when you are getting to the later stage, so the world bodies that control cancer care have grouped this sarcomas into about 4 stages. So if you catch somebody at the early stage, which is stage 1, of course, you get a very good result. And if you're catching people at the late stages, when that malignant tumor has moved to other parts of the body, then the prognosis, which we call the outcome, is very poor. And that is why every country is encouraged to have awareness about these lumps and bumps, so that these things can be picked up. As rare as they are, they can be picked up at the early stage, and then the outcome can be good and improve care for people who are affected.
Right. Thank you so much. There's a lot of information that you have pushed in that commentary. So obviously, people will be wondering that, okay, some of our clients or some of our viewers, they might be saying, oh yeah, I have this lump and bumps. It's been there. Some will say it's been there since I was born. Some will say it has been there for like 10, 20 years. Do I need to worry? I know you've mentioned a few things that, from the clinician aspects that we need to look into that will get us worried. But from the patient aspects, they need to show these bumps to somebody if it appears. But for those ones that have had it for so long, and they say, oh, it's been there for long, what do I need to worry about? Is there any advice you want to give us?
Okay, thank you, Dr. Ogunremi. I think what would be more important is what I will tell. If I'm putting myself in the patient's perspective now, and the Nigerian environment. If I have a lump anywhere, I will get somebody first to have a look at it. If it's somewhere I can see for myself, I want to see whether that's like the takeaway message from this talk this morning is, if you have a lump that is of that side, about 3 to 4 centimeters, get somebody qualified, and we're talking about a doctor, to have a look at it for you, and then tell you whether you need a specialist evaluation. So the doctor should be able to tell you what his worries are from the history taking and the questions that the doctors will. And those questions include the fact that, is it growing bigger? Is it bothering you? Is it painful? A lot of time people don't even know the size, whether it's growing bigger or not, because there are some malignant or cancerous ones that are slow growing, and you may be increasing in size over time. So the general rule is that if you have a sizable lump, about 3 to 4 centimeters, get it checked out by somebody qualified. And we'll talk about the evaluation strategy as we go along. Now, the other thing that I would like to say is that some people will say, oh, I've been born with it. It has not bothered me. It stayed that way. I think it's still important to get it checked out all the same, and be sure that it has stayed the way it has always been over those number of years, because we have had circumstances, and it's documented well in literatures, where things have been quiet for a number of years, but they then transform. they transform from being benign into the malignant type. So I think it's always important to check out lumps and bumps. So that would be my my message to people generally.
Okay, thank you so much. And then in a situation where an individual comes in and then they they said this lump is not to 3 centimeters. So am I safe? Do I get worried still, or do I still get someone to check it out? What advice do we want to give the viewers in that perspective?
Okay, so what
if it's less than 3 centimeters?
So if it's less than 3 centimeters, it's not bothering the individual. The general rule is that people tend to say that that's not likely to be the serious one, which is a sarcoma or which is a cancerous type. What I would say at that point is if you're at home, you can actually monitor the size yourself. One of the easiest ways to monitor a sign is if you put your finger, the size of the width of your finger on the swelling. Most people's finger an adult will range between 2 to 3 centimeters. You look at it that first day, you see that is that size. You can actually determine if it has grown bigger in about a week's time and see whether it's extending beyond the limit of where you measured last week. The other thing is to actually get somebody to measure it for you. I mean, it doesn't take too much to buy a tape and just measure, like what we are discussing now. Measure whether that is actually 3 centimeters or 4 centimeters. And in about a week's time, try and repeat that again and see whether the extent of the lesion in terms of the length has increased. But I think more importantly, what is more important is to get things checked out by our primary care provider. If you just a minute. If you get to a doctor, what a doctor will be doing primarily is to measure the size.
We're struggling to hear you again.
I've been describing. Can you
hear me?
Dr.
Idowu, we're struggling to hear you. Yeah, it's a bit distant.
I think I may have to change location. Okay. I think the problem may be.
Okay, we can hear.
Is that better now?
Yes.
Is it better now? Yeah.
Yeah. A lot better.
Okay.
It's a lot better.
It's a lot better. So yeah. So it depends on, I would say generally, because of the environment that we live and the access that people may have, it may be better to get a health care provider to check that swelling out. And what the healthcare provider will be asking for are things like the history. We've emphasized how progressive it is, whether it's extending in size or not. The next thing that a healthcare provider that is worried they want to do is to do some imaging modalities. The commonest one is an X-ray. And of course, let's remember that if it's a soft tissue, you will not see anything on the X-ray. But ultrasound scan has become very useful. So an ultrasound scan can tell us where this lesion is in terms of whether it's deep to the deep fascia, whether it's deep to the skin and subcutaneous tissue. It also tells us the type of lesion it is. Is it fluid filled? Is it solid? So you have a cystic lesion, which is fluid filled, is likely to be more benign than malignant until proven otherwise. A more solid one, then you are beginning to get worried about the possibility of the cancerous type, which is the sarcoma. And of course, once you do the ultrasound scan, a good radiologist or sonographer can give you the characteristics and point you in the direction of what needs to be done in terms of biopsy for the lesion. So when I talk about biopsy, we're talking about taking a little part of the swelling to the clever doctors in the laboratory. I'm sure you can still hear me well. Dr. Ogunremi?
Yes. Okay. Sure.
So biopsy means when you have the opportunity to when a healthcare provider is worried about this lesion and has done an ultrasound scan, usually we'll have a referral to somebody to evaluate it further. And that's at the point that you want to plan a biopsy. So a biopsy means just taking a little of the lesion, sending it to the clever doctors in the laboratory to look at it under the microscope, and they can tell us exactly what the nature of that lump or bump. So the biopsy itself can just be an office procedure that you just have a look under local anesthetic. A little of that tissue can be harvested with a needle and sent to the laboratory. Sometimes that is not possible, or that may not give you the full picture. In that case, you have to do a more elaborate biopsy in the theater, which entails making a cut, a bigger cut over the swelling to remove enough to send to the laboratory for the pathologists. Those are the clever doctors that I speak about, to look at it critically and tell us whether this is the simple type, which is a benign one, or is a malignant one, which is the cancerous one. And then, of course, that once the diagnosis is made, we can plan treatment appropriately. But I will emphasize that when you're getting to the point where ultrasound scan has been done by a primary care provider, I think generally these lumps and bumps are better managed in a specialized center. When specialized center, we're talking about our teaching hospitals, our federal medical centers, or our specialist private hospitals, where you have enough hands, because the treatment of these lumps and bumps is not just a one doctor affair. You find out that people tend to collaborate to get the best results. So you need to have an appropriate team, a radiologist, radiotherapy and oncology specialist, a surgeon who is dedicated to the care of this lump and bump, and you have physiotherapies, all of that supports medical staff to make sure that the outcome is appropriate.
Okay, thank you so much. So I was going to talk about evaluation, but it looks to me like you have actually gone into some level of explanation around that area. So obviously, to our viewers, we've been talking about lumps and bumps, and we have in the house Dr. Oluseyi Idowu, who is a specialist in cancer management, especially around the bones and things like that. So we have talked about what's lumps and bumps are. We have also talked about how patient presents and what are the worrying signs that we need to keep an eye on. So I want to ask Dr. Idowu, and this will be something that I think will be very useful for our doctors, to be honest, to see, in terms of their assessment, their evaluation. Maybe we might need to go a bit deeper to let them know, because we've asked patients when they have this, they should go to primary care units, which is usually the first point of call. What are the things that you would expect from your own end as a super specialist? I always call you. What are the things that you expect from our primary care doctors, in Nigeria, around situations like this?
What I would say is, it's still one of the most useful tools is the size of the lump, especially when we're talking about soft tissue ones. The size of the lump, I would emphasize again, the size of a tennis ball, the size of a golf ball. If as a primary care provider, I find myself in any part of Nigeria, I would take away that message that if that size is up to 4 centimeters, when in doubt, I will refer. Unless I'm able to get more specialized imaging to show us the deeper pictures of that lesion, but which is not always available. We all know where we work. So I would refer. And referral is, a lot of people need to understand that referral is a form of treatment. The patient will be forever grateful to you that you have referred early, as in you've told the patient, educated them that, look, this thing is bigger than this size. The guideline generally is, if you have this, let us get you to a specialized center. Now, I know that may be easier said than done, but what I also advise primary care provider is, number one, we're all encouraged to keep abreast with continuous professional development. So information is flowing to us regularly. Number two is to develop networks. So people in primary care can have partner institutions where they have relationship with people who look after certain conditions, lumps and bump conditions. If you have a relationship with a tertiary care center like National Orthopedic Hospital Igobi or the Lagos University Teaching Hospital or the Federal Medical Centers, there are trained specialists there who you can easily give a letter to, and of course the referral and the is fast tracked because the relationship has been robust from time. So I think the message for the primary care provider is that side is key. Now, when we're talking about soft tissue, that is, but when it's something that is deeper to the bone, apart from the size, what we've not discussed so far in this is unexplained bone pain. When you have unexplained deep pain or bone pain that you can't explain, even in children, and as we're saying, this can occur in a lot of children, especially in the adolescent age group. As they're growing in the growth spurt, they tend to have what we call osteosarcoma. There's a peak of osteosarcoma, which is a bone malignancy. So if you find unexplained bone pain or unexplained pain whatsoever as well, it's important to get a specialist to evaluate this. What would always happen is that specialist would escalate things and then set out the appropriate evaluation that would that we have explained or that we have talked about previously.
Right. Thank you. Now, one thing that I know, that operates in Nigeria, like we all know, is we have doctors who will, obviously they will want to make sure that they explore things in depth before they actually refer patients. And some are quite bold, and then they will be happy to take, biopsies. I've seen cases where patients come and tell, so many years ago, I had this lumps I was taken out from this side, but the side is now swollen now. It's not settling and things like that. And they might come back now. They're coming with ulcer. And then the question I always ask is, where was the report of the biopsy that was done? And some cases that have been, I'm talking about practical experience now, where then there's no biopsy done. What sort of advice do we want to give these colleagues?
So it's understandable. Primary care sometimes are private medical practice, and they want to keep their patients and keep the patronage. One thing I would advise is we should always remember that you keep patronage when the outcome is poor. The patients are the best on the long run.
We're struggling to hear you again.
Hello, Femi.
Yeah, we're struggling to hear you again. You're breaking.
Is it better now?
Yes, it's now better again.
I understand that in many parts of the country, we are served by private primary care providers. And what a lot of these centers want to do is which is important for the survival of the institution. But what we remember is that when a patient has a poor outcome, the patronage will still not be. The patient is not likely to appreciate what's been done for him, or the patient is likely thankful. So advice is that when one is in doubt, refer. That is very something it depends on the duration of that. That is why I've emphasized the importance of having relationships. Can you hear me? Can you hear me, Dr. Ogunremi?
We're struggling. I'm struggling to hear you now.
Can you hear me better? Is it better now?
Yeah, it seems so. When you keep talking, we'll find
out. What is important is when you are in a location where your access such an institution is far away, it may be important to liaise with somebody. You can have relationship. That's the importance of building networks. Have relations with somebody who has more interest in things like lumps and bumps. And with the advent of modern technology, one can take pictures. I'm sure you can better now.
Yeah.
We can make use of the internet, which has provided with different virtual platforms, picture, videos of what the swelling looks, and that would immediately be available to somebody, a specialist, to have a look at it, and then advise whether it's a lesion that one should be worried about, or whether it's a lesion that one can observe for some time. And even some we've done an ultrasound scan. I mean, ultrasound scan is readily available in centers, even the private medical centers, and to quickly do ultrasound scan and send reports and the pictures of those scans to a specialist to have a look at it and advise accordingly. What I will discourage is, if you are not going to look after the patient's lump on the long run, please don't stick a needle. By sticking a needle, I mean biopsy, because I remember what Dr. Ogunremi just spoke about, personal experience. I'm sure a lot of Nigerian doctors have had similar experience. What it does is that it converts a simple lump into a complex lump that is more difficult to manage. So the general advice is, if you are not likely to be looking after the patient on the long run, taking out the tumor, caring for this patient, and likely to monitor them on a follow-up, please don't stick the needle. I mean, by sticking the needle, I mean the biopsy. That is the general advice, because it makes for appropriate planning.
Okay, thank you. That's I think that's quite valuable. So this is a message to colleagues, primary care, secondary care, whoever is looking after a patient. So what we're hearing here is we need to be careful. If we're not sure of the lumps, we're not going to take care of the patient on a long-term basis. Do not do the biopsy. Do not stick any needle. Do not do the biopsy. Is the message that is very strong, and it's coming out from Dr. Oluseyi Idowu now. So now I want to talk. I want us to talk around what options are available. You've talked about the use of technology, and that will even lead me to our sponsor, which is Area Doc. And this is one of the things that Area Doc app is able to help in alleviating. So for specialists who have interest in tapping into such such opportunity that you just talked about, I would suggest that you send us an email on hello@areadoc.ng. So you can send a message. From there, we can assess your credentials and see if we can put you on Area Doc platform, whereby you can link up with specialists in various secondary or tertiary care, where you can create a kind of collaboration and kind of an arrangement whereby if you have cases like this and you want to send to them, you can send via either pictures, videos, and things, and they can review things, and then you can move things forward. It's all about the patient, because patient is at the center of the care that we need to be delivering in this country. So thank you, Dr. Idowu. But presently, what are the referral channel? If we're not talking about the advent of new technology that is coming up, how have we been managing these cases, collaborating from primary care to secondary care? What sort of relationship do we have, and how has it been, and so far the journey?
So it's thank you for the question. It's been challenging, but if you ask me, in the last few years, are things improving? Yeah, I don't have data to back it up, but I think things are improving. And I think that I will give a lot of credit to people who have dedicated their time and energy towards the advocacy about cancers and swellings, and what swellings can do, and why people should present early. I don't know if you can hear me well. So
yeah, we're you.
So in terms of presentation, there are about 3 different patterns that we've identified. You have patients who actually follow the the smooth pattern, they are referred by their primary care providers, they get to a specialist center, they get evaluated on time. Don't forget again, there may be problem at the evaluation because of cost. People have to pay for these services and they are expensive. So of course, that's a different ball game entirely. So that's one way to look at it, which is I think that's a more desirable pattern when you're referred by your primary care provider and you get to a specialist center, and then you are able to get your evaluation quickly and start your treatment. The other pattern that we've noticed is people coming from traditional care providers in the rural areas, and even in cities, they exist. And what you get is that those people sometimes may delay the referral for various reasons, either for their own gain or maybe out of ignorance. I need to be honest. And then you find out that by the time the patient is presenting at the specialist center, they sent a lump that is the size of 4 centimeters a few months ago, has become fungating. What I mean by fungating is that it has turned to an ulcer, a wound all over the skin. And of course, Dr. Ogunremi, you know what happens with a swelling that has become like an ulcer. It's more difficult to treat. There are more complications with it. It's likely to have spread to other parts of the body. So that's another pattern. Then, curiously, another pattern is the other ones that we try to discourage that we've spoken before. Colleagues and people in the primary care delaying referral, either doing what you've described before in one of the comments you made previously. They actually did inadvertent or inappropriate biopsy, making the treatment more complicated. So what we've done as stakeholders is, for instance, I can speak for my colleagues that were in the treatment of musculoskeletal care, especially, is to have like an advocacy group. So right now we have an NGO that is called MONSOF. It's basically Musculoskeletal Oncology Society, a support foundation, which tries to provide awareness, and they've done a few like yearly or twice yearly program to raise awareness on this lumps and bump. We also have programs that we sit people down and talk to them about it. We also provide some support for patients who are indigent and cannot afford their treatment, with the sole aim of making sure that the diagnosis of these conditions are quicker, and then you can get your treatment access. But that is just one organization. There's still a lot that needs to be done to reach the general populace and emphasize the key takeaway messages from this talk this morning, so that people are aware that these things can be dealt with quickly only if they are referred to the right channel or the right specialist as soon as possible.
Okay, thank you so much. Now we've heard about the challenges that is there. So what's your advice for the government in this sphere?
Okay, so I think the major problem over the years, we all know the truth, Dr. Ogunremi, is planning and implementation of that plan. So you find out that if you ask anybody in government, they will tell you the past 20, 30 years to do this by primary health care and improve diagnosis of conditions. But I think part of the problem has always been the government bureaucracy. We all know what is going on in the country at the moment, various issues, people being challenged or proved for corruption of government funding. So the funding aspect would hinder implementation. When the funding, even when you plan and budget so amount of money to implement it, the funding is not channeled properly. There's no beautiful program that without appropriate one. Number two, again, is, like we said, implementation, all the factors that affect implementation. So what happens in many other societies is people are moved beyond discussing these problems and the challenges. Yes, we know they're challenges. We've been talking about these challenges for years. But what we should be talking about at this point are our implementation is, and then we're talking about what can we do in 1 year. We have a 1 year plan, a 2 year plan, a 3 year plan, a 5 year plan. This is where we want to be. Obviously, we're not going to achieve everything one day. So if we start planning appropriately by strengthening our primary healthcare centers, these messages that I have, we can have more pathways available for those healthcare providers. So the healthcare provider in, sorry to use that example, in Ekpe or Ikorodu, knows what to do when he sees a lump and bump, and actually has access to the right information, like you described the area doc. Yes, there are things like this. Those platforms are very useful that I think government should also look into to enhance early referral. So once those information, the pictures, I'm talking about an electronic referral system that such that the details are available to the specialist almost the same day when the primary healthcare provider sees the patient. So it helps the specialist to actually plan, look at it critically and say, look, I need to make a phone call to those people now. That's the patient I need to see tomorrow, or that's the patient I need to see next week, because that patient needs urgent evaluation to speed up diagnosis and, of course, improve outcome. So the key word here is implementation. I don't want to say we don't have plans. If you check critically, Nigeria healthcare system has got plans over the last 30 years. What we need to improve upon is our implementation and funding.
Right.
That's what we think. Yeah.
Thank you so much for that very strong advice. Now we're getting to the end of the program, and I just want to quickly throw a word, summarize and throw just a word of advice as well. So thank you. We've talked around lumps and bumps. For colleagues, please let's keep our patient at the center of our care. Let's make sure that whatever we do to our patients is the best that we can do at that point in time. And then we've talked about, ways by which you can evaluate these patients and you can refer them early. For those of us that are interested, you can contact us on that email address, hello@areadoc.ng. We will be happy to move things forward to get you involved in sort of a kind of ecosystem that we're putting together to make life easier for our patients. From the patient side, you can download Area Doc as well, where you can actually contact doctors in various spheres. Now, for us at primary care, lumps, we've defined it, less than 3 centimeters, more than 3 centimeters. For less than 3 centimeters, from your primary care experience, I know people will come with things like, birthmarks and things like that. There are criteria that we need to also keep an eye on from that perspective. A change in color, change in size, change in shape, irritating, start scratching and itching. Patient is presented with things like this. Have a closer look at it. It might not be ordinary lumps, might not be ordinary bumps. It might just be maybe a skin issue that needs looking at quite early. So for patient as well, you see any of these things, you need to make sure that you see your doctor. So changing color, changing size, changing, in shape and appearance and things. See your doctor. So the bottom line is see your doctor when you have concern or you see things you do not know in your body. It's very important, just like Dr. Idowu had already emphasized in that case. And then to our government, we can only just say and plead that implementation. Please, let us get it right. People are dying, no doubt about it. It hurt my heart. I really feel pain when I think about it. Needlessly, we're losing a lot of people for things that shouldn't be. Please, let us have the heart. Let us work our way around how to move this country forward. Corruption is terrible. It's terrible in this country. It's terrible anywhere. But we need to be in a position where we have the heart, be able to empathize with others. Unfortunately, the planes are not there now for us to jump on and go to the abroad, like somebody always tell me, so this is our own. Let's work it. Let's make it happen. Thank you so much for joining us in this episode of Monitor Your Health again. And I look forward to meeting you again next week for another exciting topic. If you have any comments, you have any questions, leave it below in the comment section. We'll be picking them and we'll be addressing them one after the other. Please share this program and share it generously. Let people learn from it. Thank you so much. Have a nice weekend and bye-bye.
Thanks a lot.
Thank you. Thank you, Dr. Idowu.